Fomepizole, an antidote for methanol and ethylene glycol. What is fomepizole? Fomepizole is a simple structure like this, and one of the ring system it is having is the 1,2-pyrazole, simply known as pyrazole. So if we give the numbering to this pyrazole ring system, we can start the numbering from the saturated nitrogen. So this is 1, 2, 3, 4 and 5. So now it is having a methyl group at the 4th position. So the name of this fomepizole is the 4-methyl 1H pyrazole. So fomepizole is a simple compound which is having a methyl group at the 4th position and having the pyrazole ring system. This drug is also known as antizol, where the anti indicates it is acting like an antidote. Particularly it is acting like an antidote for the methanol and ethylene glycol. And here zole indicates it is having the pyrazole ring system. So fomepizole is commonly known as antizol. How it acts? Fomepizole mainly inhibits the metabolism of these alcohols like the methanol and ethylene glycol. So fomepizole is going to inhibit the methanol, which is having a simple structure like the CH3OH, and it also inhibits the metabolism of this ethylene glycol, which is having a structure like CH2OH and CH2OH. Methanol and ethylene glycol, when they are consumed at a toxic level, they can produce some toxic symptoms like the metabolic acidosis and visual disturbances. In such situation, the fomepizole can block their metabolism, thereby it can inhibit the production of the toxic metabolites from these two types of alcohols. Effect on the methanol metabolism. So methanol is going to be converted into formaldehyde by one of the important enzyme, alcohol dehydrogenase enzyme, ADH. This alcohol dehydrogenase enzyme causes the oxidation of this OH group into the aldehyde. So methanol is converted to formaldehyde. This formaldehyde then further oxidized to the formic acid by formaldehyde dehydrogenase enzyme. Now this formic acid, by several steps, it can be converted into carbon dioxide and water. And when this methanol is consumed at a toxic level, the methanol is converted into formic acid. So formic acid levels are accumulated within the body. This formic acid results in the metabolic acidosis, and this metabolic acidosis may lead to the visual disturbances, nausea and vomiting, and even seizures and coma in the patient. So in order to inhibit the toxic symptoms of the methanol, the conversion of the methanol to the formic acid should be inhibited. So this is carried by fomepizole. This fomepizole is going to inhibit the alcohol dehydrogenase enzyme, thereby inhibits the conversion of methanol to the formaldehyde and further conversion to formic acid. In this way, fomepizole blocks the metabolism, thereby prevents the accumulation of the formic acid within the body. Now let us see effect on the ethylene glycol metabolism. Ethylene glycol is having a structure like this and having the two alcohol groups. Now when it is oxidized, one of the alcohol group can be converted into aldehyde. We can observe that now this is having, one is the aldehyde and the one is the alcoholic group. So this compound is called as glycoaldehyde. Now this glycoaldehyde is an intermediate in the ethylene glycol metabolism which can be further oxidized. Here this aldehyde functional group can be oxidized so that it converts to a carboxylate anion, and now this structure is having the carboxylate anion and it is called as glycolate. Otherwise, this alcohol group in the glycoaldehyde can be oxidized again into the carboxylate anion. Now this compound is the glyoxylate. And finally, here this glycoaldehyde having aldehyde and alcohol both can be oxidized to produce the carboxylate anions. Now this structure is the oxalate. In this way, ethylene glycol metabolism results in the various products like the glycolate, oxalate and glyoxylate. Among these, glycolate and oxalate are producing the real toxic symptoms of the ethylene glycol within the body. So now this ethylene glycol is going to be converted into glycoaldehyde by one of the important enzyme, alcohol dehydrogenase enzyme, the same enzyme which is responsible for conversion of the methanol to the formaldehyde. So many of the alcohols are commonly oxidized by the alcohol dehydrogenase enzyme. Now this glycoaldehyde can be converted into glycolate by the aldehyde dehydrogenase enzyme. Then this glycolate can be converted into glyoxylate as well as oxalate. And as already we have seen, the two important metabolic products which are responsible for the toxic symptoms of the ethylene glycol are glycolate and oxalate. Now this glycolate and oxalate can produce the metabolic acidosis, visual disturbances, nausea and vomiting, seizures, and coma in the patient. Again, here we have to inhibit the formation of glycolate and oxalate by inhibiting the metabolism of the ethylene glycol. And since the fomepizole is having an action on the alcohol dehydrogenase, now fomepizole can block this alcohol dehydrogenase action, thereby it can inhibit the metabolism of the ethylene glycol. How it is given? Fomepizole is given whenever a toxic symptoms such as visual disturbances, nausea and vomiting, and any other toxic symptoms of the methanol and ethylene glycol are observed in the patient. Fomepizole treatment is essential when the methanol or ethylene glycol levels are greater than 20 mg per dl within the blood. And sometimes along with this fomepizole treatment, hemodialysis is also done, which is preferred when these alcoholic levels are greater than 50 mg per dl. So whenever the alcoholic levels are greater than 20 mg per deciliter, fomepizole treatment is preferable, and it is given by the IV route, and it can be initiated at an initial dose of 15 mg per kg, which is then followed by a dose of 10 mg per kg for every 12 hours. And fomepizole treatment should be continued until the alcoholic levels are less than 20 mg per deciliter. Possible side effects. Fomepizole is given according to the symptoms of the toxicity, and it is discontinued whenever this alcoholic levels are less than 20 mg per dl. So side effects can be thoroughly controlled, but during the administration of the drug may cause few of the side effects like headache, nausea, drowsiness, dizziness, and metallic taste in the patient. So these are the few of side effects that can be observed with fomepizole treatment. In this way, fomepizole is one of an specific antidote for the toxicity of the methanol and ethylene glycol. Ethylene glycol, commonly known as antifreeze, and methanol is a simple alcohol. If any of these are consumed at a toxic level, they can produce the metabolic acidosis, visual disturbances, nausea and vomiting, precipitation of seizures, and coma in the patient. For all of these toxic reactions, the metabolites of methanol and ethylene glycol are mainly responsible. Methanol is mainly converted into formic acid, whereas ethylene glycol is mainly converted into glyoxylate and oxalate, which produce the metabolic acidosis and other toxic symptoms. And whenever these alcoholic levels are greater than 20 mg per dl, the fomepizole can be used, and whenever they are greater than 50 mg per dl, hemodialysis is preferred. Fomepizole can be started at a dose of 15 mg per kg followed by 10 mg per kg for every 12 hours, and the possible side effects mainly include the headache, dizziness, nausea, metallic taste in the patients.